My story is about a long-term care facility in Lethbridge. There's only one of those as well. And my particular situation is my husband is in a dementia unit. And within this dementia unit, we have some very hard-working HCAs, the healthcare workers, and they work very hard. But in the last little while, there has been short staff. So you have 4 workers for 29 dementia patients, and oftentimes there are 3 workers, or they call them 2.5, because we get a 4-hour position, which I lobbied for when my husband first went in there, because apparently the morning staff needed 4 people to look after 29 patients. In the afternoon, they were much more efficient. I guess they only had 3 on in the afternoon. So I went to bat for the girls to make sure that there were 4 on for both morning and afternoon shifts. The situation now is we have a group of women who come in and work all the time. They are working double shifts, which are 16 hours. Dementia patients are very difficult to deal with because of their behaviors. I mean, they're not necessarily bad behaviors, but there's certainly behaviors that can cause you some stress. And we have these girls coming in working 16 hours. To say the least, by the end of their shift, they are tired. They can barely move themselves around the facility, and to say the least, they are not very patient with the residents. So not only are the healthcare workers wearing out, but the residents are directly affected because they are not getting the patient, kind, caring help that they need. And I have addressed this with the management, and I've asked the girls who come into work, where are all the healthcare workers? Because every spring and fall, there's 2 groups of companies that come in that are training the HCAs, and there's usually around 10, 15 of them in each group. So I would say 60 people are being trained in the course of the year, and I don't know where all those HCAs are ending up, but they certainly aren't ending up at the facility helping out with staffing. And I think this directly, the problem is directly affected by the fact that these people are not being hired full-time. They have no connection to the facility. A lot of them have to work 3 part-time jobs to make ends meet. And so when they're needed at one facility, they're not available at other facilities. And so we have very, very stressed out care workers looking after individuals who need a lot of patience.
Thank you for sharing that. We do that all the time in various centers across. Can we take a couple more, and then what we do is maybe...
And I actually ran for Lubo provincially a few years ago. And at that time, the Carmigay Healthcare Centre was intentionally being depleted of its residents. It was long-term care. It could hold up to 20 people. At the time, there were 18 people in the care centre. The government made up some trumped-up ideas that there was problems in the centre. They said there was asbestos. They said that the little night call things on the stands beside the patients weren't working. Only 3 of them were working. Well, it turned out only 3 people could actually use those little call buttons. There were various things. They needed about $100,000 worth of upgrading, and then it would work fine. But they decided to close it, and the people who were there were very fragile, as is often the case in long-term care. And those of us who were involved in trying to save the Carmigay Healthcare Centre, the long-term care centre, told the government, it's a very bad idea to move these people. They're fragile, many had dementia, many had many different kinds of complications. And we said, especially people with dementia need to have as much consistency as possible in their life. Consistency of people, consistency of place, consistency of routine. That if you move them, their whole body will go into such a state of anxiety, a state of turmoil, turmoil, a physical state of turmoil, that the turmoil will actually kill them. Well, the government didn't listen. They said, well, some of the people will die anyway, just by virtue of their illness, which seemed quite callous. This all transpired during the summer when the legislature was not sitting. Of course, it doesn't sit much anyway. And when it does sit, it sits all night to wear out the opposition. But it happened in the summer, and everyone was away on holidays. Now, this happening in a rural center was something that we had to take note of, because it looked like things were happening down in this area, in Carmen Gay, in the summer, in a small village, Carmen Gay, just down the road here. It's a tiny little village, 18 people in long-term care, and we figured it was a test case. And so we made as much noise as possible. And we got Sandra Azocare to come down, and David Agan. We had rallies and everything else. The newspaper, the Global TV, CTV, everyone was terrific in coming and helping us to highlight this problem. But we still couldn't get anything changed. Eventually the residents were moved out. They were moved to other centers, some 50, 75, 100 kilometers away. What happened was, 2 of the people each died within a week of being moved, which was exactly what we said would happen. When we told the government, they just brushed it off. Oh, they were ill, they would have died anyway. But we maintain that it was the movement itself that actually killed these people in long-term care. We find this is criminal behavior, and people should know about this, and it should be stopped. Thank you.
Thank you for sharing.
I promised myself I wasn't going to do this. I think I owe it to, there's an alderman sitting right there. This story that you've been relating to here, I went through with my mother-in-law, and I don't think I need to retell it because same thing. It was a private care facility. Every time something happened, the price went up. And by the end of the day, she was paying about $4,000 a month. And I went through the same thing with my wife. She didn't end up in assisted living, but we were doing the same thing with the Greystokes and the various other helping agencies in town here, the HCAs, or HACs? HCAs now, yes. And, I think you hit the nail right on the head. You have one weapon in this room that's very, very powerful, and that is your vote. Now, in this province, we hardly ever get over 40%. So that means there's a lot of people in this room sat on their ass last time. Get out and vote for somebody, and don't vote for the existing people. Because this province is like a boat. It's a big boat, and you can't stop it and turn it easily. Once you start building P3s and going down the road and closing healthcare facilities that have been in existence for 40 years, and that went up in Carmen Gate, you can't bring that building back. Once that thing's done, you might as well knock it down. It's finished. And if you let them go that way, we're all going to be living in a P3. And in a province where we don't have a tax like they do in Saskatchewan, we're dependent completely on the price of oil. When the price of oil is up, everybody in Edmonton is singing. When the price of oil is down, they're not singing. They're cutting everything off as quick as possible. So I suggest the next time we have an election, there should be some hard questions for whoever the candidates are, and vote for the good of what you know is going to come, because there's a lot more baby boomers that are sitting in this room. I'm only 64, and there's an awful lot of people that are going to be looking for care here in the next 15 years, and there's going to be nowhere to go.
Yeah, I'm Charlotte. I'm a registered nurse. I graduated April 2012. And when you were telling, I can't remember which one, was telling stories about assisted living care, I worked at one on the west side, not to be named, but there's only one on the west side. But I worked there, and it was very hard work. You started at 7 o'clock in the morning and you ran the whole time. And it was very hard work while I was in nursing school. And I tried to address those needs to the LPN there, and she was very responsive to it. And one day she suggested me to write down exactly how long I spent for each resident there, how long it took me to do all the care that I needed to. So I wrote it all down, and we all came to the conclusion that there wasn't enough time to get all of the needs met for each resident, because there were so high needs, and it was assisted living, so it was assumed that they were able to take care of themselves, but that wasn't the case. So I presented that to the LPN on staff, and she said to photocopy it, and I presented it to my manager. And the top and tail of it is she called me incompetent because I wasn't able to take care of the people. And I did cry afterwards because I got told off by my manager. It was just really disheartening because I tried my best and I was trying to advocate for the residents that I was looking after. So that's kind of my story about that, and just how I was so excited to leave that place and very disheartened because I knew that they could easily just find more workers that were eager just to get paid, but will face that same frustrations that I've faced. And that's kind of where it ended, and I was just too scared, to be completely honest, to go further because I'd been scolded and worried about losing my job. So I had wished that, looking back, that I'd done more about it and I would have been educated more about what I could do. But that's my story.
My husband and myself recently, well not so recently, moved from Saskatchewan. I was also very, very active in the healthcare workers in Saskatchewan as president of a very prominent QP local. I was kind of in on the bottom end of when they brought volunteers in. That's when we started losing healthcare positions in Saskatchewan, and I think it's all filtered down through. So we may be making some demands to have the places to be put, but darn it, we are entitled to have the properly trained people looking after us, and not having to depend on families to come in and make sure that we're fed properly, that we're cleaned properly, and then, I guess bottom line, that somebody cares about us. We know the people around us want to, but they don't have the time. And I'm a trained LPN. I was trained in 3 different parts of my training: spiritual, emotional, and then physical. Because if you don't take care of somebody's spirit, and you don't take care of their emotions, they will never survive, they will never get better. So I think that's something that we really need to advocate to, is properly trained people in our long-term care facilities.